We're going to warm up before our cardio burst with a couple of stretches for the front of the shoulder. I'll have you move to the wall, bringing one arm into a V, start facing the wall, and twisting away from the wall. We'll be holding this stretch for a full minute because it's a postural stretch. Each breath is a chance to twist a little further with awareness of the checkpoint. Soft bend in the knees. Weight evenly distributed between the feet. Sternum reaching towards the back ribs, shoulders plugged down the back. Exhale to twist. Inhale, prepare, brace the abs. Exhale, twist. Moving only on your exhale, thinking about your inhale as a chance to check in with where everything is. Are the ribs spraying forward? Are the abs pulled in? Are the shoulders down the back? Is the chin retracted? Double chin. Go ahead and switch sides. Coming to your V wall stretch on the other side, starting facing the wall, and then twisting. Breathe in through the nose, brace the abs, and exhale, twist deeply. Make sure as you're working, you're thinking about the breath and the connection of the contraction of the TVA to the movement deeper into the stretch. So soft bend in your knees, equal weight distribution in the feet. Inhale, pull the abs in, lift up on the muscles that stop your stream of pee. Exhale, fog of air, twist deeply. We'll move back to the first side, bringing our arm into a W or a cactus goalpost position and twisting away. We'll get into the pec minor here. Same idea of soft bend in the knees, tailbone reaching down and back, little lumbar extension, abs are pulled in and up, sternum is reaching towards the back body, shoulders are plugged down the back, collarbone is wide, chin is retracted. Inhale, pull your abs in, tug up on the muscles that stop your stream pee and fog a mirror as you exhale, twisting deeper. Switching sides, setting up for our final wall stretch before we learn our cardio burst exercises. Quality of stretching is important, so think about the quality of the movement. Never push yourself into a stretch quickly. The front of the shoulder especially is very delicate, and we wouldn't want to pull anything. So moving on the breath will guarantee safety. Inhale, brace the abs, and exhale, twist from the torso. Soft bend in your knees, tailbone reaching back, feeling that lumbar extension, but the lift in and up of those lower abdominals. Your chin's retracted, back of neck is lengthening. You're using the wall to leverage and press to twist deeper. So from here, we're going to need our lightest loop band and our lightest Theraband, and we're going to set up and learn our exercises. So I'd like you to do these exercises at 50% effort as you're learning them, and then we'll take them up to 100% when we begin our cardio burst. The first exercise will be done in the frontal plane, which is traveling side to side. You'll take your lightest loop band and bring it around your ankles, and we'll start with 4 oblique crunches on the same side, and then we'll do a gallop step with the accent being up. So we're going up, engaging those hip flexors as we press and using the quadriceps, feeling the heels really pressing as well. And then we repeat on the other side. So whatever direction you've traveled, that's where you'll do your cactus arms and your loaded oblique crunch. Make sure the foot that's coming up is dorsiflex. This will guarantee proper knee traction and recruitment of your hip flexors. So 4, and then your gallop with the accent up step. And 4, gallop up, accent step. Go at your own tempo right now, remembering we're learning the exercises, making sure you can do the movement confidently so that when we take it up to 100% effort, you're ready. One more time. So now we're going to learn our exercise in the transverse plane. Transverse plane is where 90% of injuries occur, and this is when we turn. We'll be doing a quarter turn, marching, keeping the loop band around the ankles, dorsiflexing the feet, and we'll swing the arms. Give me 8 marches, and then we'll do 8 punches on the diagonal, going from low to high, alternating sides. 8, 7, 6, 5, 4, 3, 2, 1. Back into our marches, dorsiflexing the foot, bringing it around. For the sake of recruiting our hip flexors and learning the movement, let's not swing our arms now. Let's just hold our hands on our hips, and we'll move our arms when we do our punches, but we'll focus on the legs, the dorsiflexion of the feet, the lift of the legs. The tailbone reaching back is really important here so that we don't slip into pelvic flexion. So tailbone back, abs braced to find lumbar extension as you lift the leg that's loaded with the light loop band. Our final exercise in the sagittal plane, we'll grab our lightest Theraband, taking it behind us with the palms forward. We'll pull out on it and we'll dorsiflex and dig our heels into the ground, alternating as we go forward, working on the plantar flexion in the ankles, combating that, and getting our heart rate up as we do 8 alternating heel digs forward. 8, 7, 6, 5, 4, 3, 2, 1. We'll stand with both feet on solid ground, soft bend in the knees, and we'll alternate 4 times lateral flexion, pulling out on the band. 4, 3, 2, 1, and we'll repeat going back, pulling out on the band with both arms, heel digs traveling back. Really dorsiflex your foot. Each foot should be dorsiflexing, toes reaching towards the face. Heels should feel the weight. And then your lateral flexion, you pull out on the band on the side you're bending towards. Let's set up for our first exercise burst in the frontal plane. Putting the loop band around your feet. Remembering that this is our oblique crunch 4 times and our gallop step. Okay, counting you in. 3, 2, 1, go. 100% effort here. 4 oblique crunches, thinking about a sternum reaching towards the back ribs, shoulders plugging down the back. Really, range of motion here is important too. Really side bend, engaging the external obliques. Remember your gallop, the accent up, feel your heels pressing into the floor. Make sure that foot stays dorsiflexed to keep the knee safe. Try and not press your rib cage forward. Try to keep it closed. You're doing great. Remember, 100% effort. This is for your heart health. This is for your endurance. This will alleviate stress. 10 more seconds, counting you down. 8, 7, 6, 5, 4, 3, 2, 1. Take your recovery. I don't want you to sit down, but you're welcome to get water or take a stretch if you need to stretch. But we want the heart to drop back down. We're taking minute recoveries. As you work with us, we'll take those recoveries down to 30 seconds to continue helping you increase your endurance for your heart health. You've got 20 more seconds before we set up for our second set in the frontal plane at 100% effort. Remember, we're only doing 6 full out bursts, so you've got to give it all you've got. Counting you in. 8, 7, 6, 5, 4, 3, 2, and go. 4 oblique crunches, collarbone wide, sternum reaching towards the back ribs, dorsiflexed foot. Accent is up on the gallop, transition step to the side. Moving in the frontal plane with awareness. Dorsiflexion in that foot as you do your oblique crunches. We're targeting your external obliques. We're building strength in those long, weak hip flexors. This will pull you back into perfect posture, combating that plantar flexion in the ankles. Check in with your breath. Breathe naturally. Watch out for holding the breath because that's not going to allow oxygen to the muscles we're working. Keep the shoulders down the back. Tuck your chin so the back of the neck is long and the front of the neck, which is very underactive, the neck flexors are working. Any chance we get, we want to work the front of the neck because that keeps the back of the neck and the side of the neck where we overwork safe. Counting you down. 6, 5, 4, 3, 2, rest. While we're recovering here, I'll remind you of our next exercise in the transverse plane. This is our turning plane where 90% of injuries occur. We keep the loop band around our feet, hands on our hips, and we march, taking a turn with dorsiflexed feet. After 8 marches, we stand in place with a soft bend in the knees, and we go from low to high with alternating punches. 8, 7, 6, 5, 4, 3, 2, 1. Then we repeat. You're going to give me 100% effort. The National Heart Association says between 4 to 8 bursts 3 times a week is the minimum individuals need to do for heart health. That's with a 3 to 5 minute recovery and a 3 to 5 minute warm-up. We're doing 6 bursts today. You've done an excellent warm-up and you'll do an excellent recovery. So give it all you got. I'm counting you in. 5, 4, 3, 2, go. Marching, dorsiflexing the foot, hands on the hips. Once you get around and you've done 8 marches, you do your 8 punches, going from low to high, crossing the body, engaging the transverse abdominis. Remember to brace the abs, reach the tailbone back for your lumbar extension. Always keep the knees soft so we're not bowing out or rolling out, supinating, or plantar flexing and rolling forward. We've got to get the weight distribution in the feet and ankles correct. This will affect the whole chain and perfecting your posture. Check in with your breath. As you're working, are your feet flexing, dorsiflexing as you do those marches? Lift up through your center. Make sure the tailbone isn't rounding under as you march. Reach that tailbone back. Lumbar extension. Brace the abs. You're doing great. Give it 100% effort. Make sure you're breathing. Counting you down. 3, 2, 1. Take your break. Excellent work. As I said, the National Heart Association says between 4 to 8 bursts 3 times a week is the minimum one needs to do for heart health. We're doing 6 bursts a day. We have our recoveries of a full minute, and as you work with us, we'll cut those recoveries down to 30 seconds, really conditioning the heart for your health long term. Take water here. Just make sure you don't sit down. We're conditioning the heart to handle stress and anxiety. This is the most time-efficient way to do cardio, and you're burning just as many calories because of the intensity level. So you've got 10 seconds, and we're going to repeat our exercise in the transverse plane. Counting you in. 5, 4, 3, 2, go. 100% effort. Give it all you got. Dorsiflex those feet. Reach the tailbone back. Lumbar extension with braced abs. Make sure those cross punches are quick and you're not moving your hips or legs. The twisting is happening in the torso. You're bracing your abdominals. Really recruiting the transverse abdominis, lifting in and up on those muscles that stop your stream of pee without tucking your pelvis under, keeping that tailbone tipping back, being aware of the chin retraction, working those neck flexors to alleviate the back of the neck tension and pain. Thinking about the rib cage. What's happening? Are the ribs pressing forward, or are you able to keep the sternum reaching towards the back ribs? This will help you access your upper back muscles to combat the kyphosis, and it'll also help you find the lower abdominals as you lift in and up, contracting your transverse abdominis. Counting you down. 5, 4, 3, 2, 1. Take your break. Water. Stand still. Take a stretch if something's feeling like it needs it, but don't sit down. I'll remind you of our final exercise, moving in the sagittal plane forward and back. For this one, we just need our lightest Theraband. Can remove that light loop band. And we'll be moving forward and back, pulling out on the band as we travel forward and back, digging the heels down, alternating heel digs with dorsiflexed feet. And at the top and the bottom of the mat, we'll do lateral flexion with a soft bend in the knees, alternating sides. Palms are forward. You pull out on the band on the side you're bending towards. Make sure there's no rounding in the front of the shoulders as you pull out. Sternum's reaching towards the back body. Upper back's engaged. You'll access your external obliques and your QL as you bend side to side. And then as we travel back, we'll work on combating that plantar flexion in the ankles and elevating the heart rate as we pull out on the band and lift in and up on the lower abs. Here we go. Counting you in. 3, 2, 1. 100% effort. 8 heel digs traveling forward. Try to keep the legs hip distance apart. They may creep in closer to your center line, but if they stay hip distance apart, you have more of that center core back stability working for you. Then it gets very tricky when you get narrow. You will feel the adductor line pulling in and up to help you with your balance if you choose to go very narrow with the feet. But since we are starting at level 1 here, I'd like you to keep the legs hip distance if at all possible. Nice dorsiflexed feet. Remember, the palms are facing forward as you pull out on that band, engaging those external obliques, alternating sides. 100% effort. Really go, 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 go. Push yourself more than you think you can. Counting you down. 5, 4, 3, 2, rest. This is our final recovery before our final burst. Only 1 more minute to go, and then we get to stretch. So I want you to really work hard for this next minute. Be cognizant of those checkpoints, your dorsiflexion in your feet, your legs staying hip distance apart, your arms long by your sides, pulling out on the band as you travel forward and back. When you pull out on that band and the palms are behind you and facing forward, you retract your serratus anterior, and this is your shoulder blade anchor. This is what will combat the rounding in the front of the shoulders, bringing you into optimal alignment, taking away that kyphotic position in the upper body. Make sure you're breathing here. I'm going to count you in. Here we go. 5, 4, 3, 2, 1. Go. Give it all you've got. 100% effort. You should be sweating. Make sure you're breathing. Dorsiflex those feet, hip distance apart, toes reaching towards the face, abs pulling in towards the spine, sternum reaching towards the back body, collarbone wide, shoulders plugged down the back. Really go far on those side bends, pulling out on the band on the same side you're bending towards. Keep a soft bend in the knees when you're stationary at the top and bottom of your mat, doing your lateral flexion. We don't want to lock out. We don't want to roll out on the feet or move into that plantar flexion in the ankles that is so prevalent in flat back posture. You're doing great. 20 seconds to go. Really focus. 100% effort. Breathe. Collarbone wide, sternum reaching towards the spine. Close those ribs. Lift in and up on the muscles that stop your stream of pee. Breathe. Counting you down. 3, 2, 1. Great job.